Hello, everybody. I'm Thanga Katimada. I'm a consultant in obstetrics and gynecology, and I have worked in the NHS for the past 15 years. I also practice in the Medics Clinic as well as the Harley Street Consulting Clinics at Bedford. Today, I've been asked to give a talk on heavy menstrual bleeding, and I'm really excited to talk about this topic because it is very common among women of reproductive age group, and it can significantly affect the quality of life. So what is menorrhagia? Now, menorrhagia used to be the old terminology. We now use the term heavy menstrual bleeding. So it's just a change in terminology. Now, experimentally, when people were conducting researches, they would define heavy menstrual bleeding as a bleeding which lasts for more than 7 days and or bleeding which is more than 80 mils every period. However, most women are not able to confine themselves to these very strict measurements, but most women know that they are bleeding heavily. So any bleeding which is affecting the woman's health or her quality of life is now considered as heavy menstrual bleeding. So, for example, if a woman is bleeding to the extent that she has to use double protection, she is needing to change a soaked pad more than every 3 hours, or if she's confined to her house and unable to go to work or go on with her social life because of the heavy menstrual bleeding, then that is considered to be heavy. So when you see a gynecologist, the things that the gynecologist will ask you to ascertain whether you have heavy menstrual bleeding are things like how many pads do you need to change during the day? Do you need to use double protection like a tampon as well as a large pad? Are you passing large clots? And that is a sign of excessive bleeding, which the uterus's mechanism to prevent clots is not being able to handle. The other symptom, which is very significant, is if you have to wake up in the night to change a pad, or you find yourself flooding on the bed when you wake up in the morning. And particularly if you are diagnosed with anemia, one of the things in a woman of reproductive age group that we would rule out is if your periods are heavy. Heavy menstrual bleeding can be as a result of another condition, but very often it is due to hormonal imbalance. Of course, it depends upon the woman's age as to what could be the possible cause for the heavy menstrual bleeding. For example, in the beginning of the reproductive age group, that is when women have just started their period, or towards the end of the reproductive age group, that is the few years before the menopause, periods can be really heavy, and that is because of a disturbance in the mechanism of hormones which are secreted in the body, particularly between the brain, the ovary, and the lining of the womb. So in this particular age group, women may not ovulate as frequently, and the lack of ovulation can lead to heavy periods. So this is physiological, and it is not a dangerous cause, and it can be easily resolved by a variety of treatment options, which I will discuss in a short while. However, in women in the early reproductive age group, there can be, in addition to hormonal imbalances, a few underlying causes which can cause heavy periods. One is, as many of you may know, fibroids can cause heavy periods. Basically, fibroids are benign growths from the muscle wall of the womb, and if they grow in the muscle wall or if they grow into the lining of the womb, then what they basically do is increase the surface area from which the bleeding occurs, and that is why you experience heavy periods. However, fibroids which grow completely outside the womb are not associated with heavy periods, and usually in those cases we have to find if there is another cause. The other thing that can cause heavy periods is a condition called adenomyosis, And this is often seen in women who have given birth to one or more children, where a little bit of the lining of the womb gets implanted in the muscle wall of the womb, and that irritates the muscle wall, and the muscle wall thickens. That also increases the surface area from which women bleed, and therefore can cause heavy periods. Of course, in a woman who has sudden onset of heavy bleeding in the reproductive age group, your gynecologist will always want to rule out the possibility of pregnancy as a cause for the heavy bleeding as well. So that is something that we have to bear in mind in women of reproductive age group. Other primary causes which are associated with the womb, which can cause heavy periods, is sometimes in women who are using the intrauterine device, particularly the copper coil. That can cause the periods to be a little heavier, especially in the first few months after its use, because of the mechanism by which the copper coil works to act as a contraceptive. This is also the case with the Mirena. Although it does not particularly cause heavy periods, it can cause prolonged bleeding in the first 6 months. Other hormonal contraceptives can also cause irregular bleeding. So that is what we call secondary to the hormonal contraception. And usually, it usually settles down after about 6 months. And if it doesn't, if we discontinue and consider another option, that is easily resolved. There can, however, be secondary causes, that is, causes outside the womb which can cause heavy periods. One is women who have a thyroid dysfunction, that is, if the thyroid gland is not working very well, can present with heavy periods. And if they do have symptoms of thyroid dysfunction, then the gynecologist may want to do a thyroid function test. Very, very rarely, women can have underlying bleeding disorders. This is particularly the case, although rare, in when young girls start their periods. If they start having very heavy periods, especially with easy bruisability, it can be due to a deficiency of a clotting factor called von Willebrand's disease. Otherwise, clotting factors disease are very, very rare. Rarely, the heavy menstrual bleeding can be due to some causes which are of concern. This particularly happens in women who are later on in their reproductive age group, that is after 40 years of age. But it can also happen in women who have what is called polycystic ovarian syndrome, even when they are young. And this is where there is so much of estrogen being produced, or there is estrogen being produced continuously, that it causes the lining of the womb to thicken and to change. Now that is we call this endometrial hyperplasia. Now, if this is not addressed in a timely manner, then many years down the line, there is a small possibility that this may change into cancer. So in young girls who have polycystic ovary syndrome, who have a higher BMI, if they have had no periods for 6 to 9 months, then it is important to investigate the lining of the womb to rule out this cause. Also, in older women, especially if they have bleeding between periods, it's important to take a biopsy of the lining of the womb to rule out this cause. So fortunately for us, there are a number of different treatment options which can really be tailored to the needs and beliefs and the lifestyle of each woman. So I have occasionally had women in my practice who are worried about their heavy periods, who are, however, managing their heavy periods without need for intervention, but are only seeking advice as to whether it is due to any dangerous cause. So in these women, what we normally do is we do an examination, because it's important to find out if the neck of the womb has any lesions. For example, is there a polyp, which is a benign growth on the neck of the womb, which is causing the bleeding. Of course, it's important for women to ensure that they are up to date with their cervical smears, because if you are not, the bleeding can be due to cancer of the neck of the womb. It is rare, but it is known to occur, particularly in women who are not up to date with their cervical smears. So that is really important. Your gynecologist may also do an ultrasound scan to rule out things like adenomyosis or fibroids. And if none of these are found, a woman may choose, especially if the bleeding is heavy only during the periods, that she does not want any hormonal or non-hormonal intervention. Now, in these small category of women, it is important to advise them to take a diet which is rich in iron, and also they may need some iron supplements to prevent anemia, because the factor that can also impair the quality of life, apart from managing the bleeding, is the resulting anemia, which can really make women feel very tired. They cannot concentrate in their day-to-day work and their professions, and that can lead them to feel very unhappy and depressed in their day-to-day work. So anemia is important to address. Also, such women must be advised to have their hemoglobin, that is the iron levels in their blood, checked at least once in 6 to 12 months to ensure that they are not becoming anemic. But having said that, most women who have heavy menstrual bleeding, particularly if it is interfering with quality of life and leading to anemia, will need some form of intervention. Now, when we talk about intervention, we have both hormonal and non-hormonal interventions. Among the hormonal interventions, most of these hormonal interventions are the common contraceptive options that we know of. The combined oral contraceptive pill in a woman who's suitable for it can be a very good option to regulate and reduce the bleeding. In women in whom the combined oral contraceptive pill is contraindicated, we can prescribe them with progesterones. In fact, according to the NICE guidance, the progesterone preparation, which is recommended as the first-line hormonal treatment, is what is called the hormone coil. So previously we had the Marina, but now there are many other brands which are being marketed, and a few of these are effective and licensed for the use of treatment of heavy menstrual bleeding. Of course, women should be warned that in the first few months, it can cause irregular and very troublesome bleeding, although not heavy. Usually in about 4 to 6 months, this settles down and gives very good control of heavy menstrual bleeding. Other hormonal options are the progesterone-only pill and the injections, the Depo-Provera injections. Some women may not want to choose hormonal options, particularly if a woman is planning to conceive. Then these hormonal options can prevent them from conceiving. So in these women, we can give medication which is effective in reducing heavy periods at the time of the period. One such preparation is called tranexamic acid. It is widely used in surgical practices, and it is very effective in reducing the amount of bleeding and the volume of bleeding during the heavy menstrual periods. Other options, when we talk about non-hormonal options, apart from tranexamic acid, which is the medical option, we also have other minimally invasive techniques as well as the major surgery. Of course, among surgical options, hysterectomy is the best option from the point of view of stopping your periods completely. Nonetheless, it is a major operation, and it does have a few complications which can have life-changing consequences, and therefore hysterectomy is often performed as a very last resort if none of the other mechanisms work, because the other mechanisms are very, very effective in the vast majority of women. One such option is what we call endometrial ablation. So it's a very easy procedure. It can be done as an outpatient, where a device is introduced into the womb and it basically burns down the lining of the womb. If you think about it, even in hysterectomy, what we are trying to get rid of is the lining of the womb from which the bleeding is coming from. So this simple procedure can get rid of the lining of the womb without you having to go through a major surgical procedure. So those are some of the treatment options. Of course, hysterectomy is the best treatment option if a woman is suspected to have what are called precancerous changes in the lining of the womb. Yes and no in certain circumstances. For example, as I mentioned, most women with heavy menstrual bleeding, if not addressed in a timely manner, will find themselves becoming anemic at some point in time. And anemia can have in its mild to moderate severity, can have an impact upon the quality of life. But if anemia is left unaddressed, especially if the hemoglobin drops significantly, a normal hemoglobin is 111 to 112. But if it drops below 50, then that can have consequences for the functioning of your heart, and it can lead to heart failure. So one should not allow the heavy menstrual bleeding to persist to such an extent that one becomes anemic to this degree. And it happens rarely in modern times because people are very aware. There is a lot of information available through social media. So we rarely see women who reach this significant state of anemia. And yes, it is important to address heavy menstrual bleeding, which is associated with changes in the cells of the lining of the womb. As I mentioned, in these cases, particularly in precancerous changes, especially if a woman has completed her family, it is important that she has a hysterectomy. If a woman hasn't completed a family, it is possible to reverse these changes by using the hormone intrauterine device, but one has to be kept under very close follow-up with regular biopsies, and eventually, after you've completed your family, it's better to have a hysterectomy. I mentioned there are a variety of reasons why quality of life is impaired by the heavy menstrual bleeding. One is that women may be really worried that there's something wrong with them, something is not right. They are sometimes worried that they may have cancer and that it is life-threatening. And some of them may be just seeking that reassurance. And it is important for us to be able to examine, minimally investigate at least, and to assure women that this may or may not be the case, and in the rare event, if it is the case, to address it as soon as possible. Secondly, anemia. It is important to treat any anemia. Any woman with heavy menstrual bleeding should also have what is called a full blood count to identify anemia. Now, anemia can be treated by iron tablets. Iron tablets can cause constipation, but it's important to supplement iron in the diet if you are anemic. But one can also make use of diet itself to correct anemia. Green leafy vegetables, red meat, and dried fruits such as walnuts and dates, they have a lot of iron in them, and it's important to supplement these things in your diet to keep your iron levels at their best. And of course, the very fact that if a woman is flooding through her clothes when she is at work because of the heavy menstrual bleeding, then she's not able to concentrate on her work. It's rather embarrassing to keep asking for time off because of something which seems so physiological and so mundane and routine as heavy menstrual bleeding. So I would say that if it is actually impacting to this extent, it is important for women to seek help from their GPs, from their specialists, and to have some form of treatment, because there are a wide option of treatments which can help you with your heavy menstrual bleeding.